If you're receiving Social Security benefits, what I'm about to tell you could completely change how much money you actually get to keep each month. We're looking at a projected 11.6% increase in Medicare Part B premiums that's going to hit 70 million seniors and Social Security beneficiaries like a freight train. And here's the kicker. This increase could completely wipe out your cost of living adjustments, meaning you might actually end up with less money in your pocket despite getting a raise on paper. In this video, I'm going to break down exactly how this massive premium increase affects your monthly Social Security checks, show you the real-world calculations that reveal just how devastating this could be for different benefit levels, and most importantly, share actionable steps you can take right now to protect yourself from losing hundreds of dollars every month. Welcome to Financial Area, where we break down the financial news that directly impacts your wallet. If this information helps you understand what's coming for your Social Security benefits, make sure to hit that like button and subscribe for more updates that could save you money. Let's start with the raw numbers, because they're absolutely staggering. The current Medicare Part B premium sits at approximately $174.70 per month, for most beneficiaries. An 11.6% increase would push that premium to around $194.96 per month. That's an additional $20.26 coming out of your Social Security check every single month, or $243.12 per year. Now, if you're thinking that doesn't sound too bad, hold on, we're just getting started. This 11.6% increase represents the largest premium jump we've seen in years. To put this in perspective, most annual Medicare premium increases hover around 3 to 5%. We're talking about more than double the typical increase hitting all at once. And remember, this premium is AU2, automatically deducted from your Social Security benefits before you ever see that money. There's no opting out, no payment plan. It just disappears from your monthly check. But here's where it gets really concerning. This increase is affecting approximately 70 million Americans who rely on Social Security and Medicare. We're not talking about a small group of people. This is impacting the vast majority of American seniors and disabled beneficiaries. For many of these individuals, Social Security represents their primary or only source of income. When a significant chunk gets automatically deducted for Medicare premiums, it creates a domino effect that ripples through their entire monthly budget. The timing couldn't be worse either. We're already seeing inflation eating away at seniors' purchasing power. Grocery bills are higher, utilities cost more, and housing expenses continue to climb. Now, on top of all that, they're facing the largest Medicare premium increase in recent memory. It's creating what experts are calling a perfect storm for retirement security. The government calculates these premium increases based on projected Medicare spending, and the numbers they're seeing for the coming year are driving this massive jump. Healthcare costs are skyrocketing. New expensive treatments are being covered, and the overall cost of medical care continues to outpace general inflation. All of these factors combine to push Medicare premiums higher, and unfortunately, beneficiaries are the ones who end up paying the price. Now let's talk about how this completely destroys the cost of living adjustments that are supposed to help seniors keep up with inflation. COLA increases are designed to ensure that Social Security benefits maintain their purchasing power as the cost of living rises. For 2025, we're looking at a COLA increase of around 2.5%, which sounds decent, until you factor in these Medicare premium increases. Here's the mathematical reality that's going to shock you. Let's say you're receiving the average Social Security benefit of about $1,900 per month. A 2.5% COLA increase would add roughly $47.50 to your monthly check. Sounds good, right? But remember that $20.26 increase in Medicare premiums? That gets automatically deducted, leaving you with a net increase of only $27.24. Your cost of living adjustment just got cut by nearly half. But it gets worse for people with lower benefits. If you receive it, $1,200 per month in Social Security, which is common for people who had lower lifetime earnings, that 2.5% COLA gives you about $30 extra per month. After the Medicare premium increase takes its $20.26 cut, you're left with less than $10 of actual benefit increase. That's not even enough to cover the increased cost of a single grocery trip. For the lowest income seniors receiving around $900 per month, the situation becomes truly dire. Their COLA increase of about $22.50 gets nearly eliminated by the Medicare premium hike. They're left with roughly $2.24 more per month. That's less than the cost of a gallon of milk. These are people who are already struggling to make ends meet, and now they're facing what amounts to a net decrease in their purchasing power. The cruel irony here is that COLA increases are supposed to be a safety net, helping seniors maintain their standard of living as costs rise. Instead, we're seeing that safety net get shredded by automatic Medicare deductions. Seniors are getting raises on paper that disappear before they ever hit their bank accounts. It's a vanishing act that leaves millions of older Americans worse off, despite what appears to be government assistance. This creates a long-term problem that compounds year after year. When Medicare premium increases consistently, eat up COLA adjustments, seniors fall further and further behind. Their fixed incomes become increasingly inadequate for meeting basic needs. We're essentially watching retirement security erode in real time for millions of Americans who worked their entire lives expecting Social Security and Medicare to provide a foundation for their later years. The psychological impact can't be ignored either. Imagine expecting a raise in your Social Security benefits, only to discover that your actual spending money has barely increased, or might have even decreased. It's demoralizing and creates anxiety about future financial security. Many seniors report feeling betrayed by a system they paid into for decades, only to see their benefits eroded by automatic deductions they can't control. But here's the good news. You're not powerless in this situation. There are concrete steps you can take right now to minimize the financial impact of these Medicare premium increases and potentially save hundreds of dollars every month. The key is understanding that not all Medicare plans are created equal, and many beneficiaries are paying far more than they need to. The most important action you can take is to review your Medicare coverage annually. Many people sign up for Medicare Part B and then never look at their options again. This is a costly mistake because Medicare plans change every year. Benefits are modified, costs are adjusted, and new options become available. What was the best choice for you last year might be costing you serious money this year. This is where services like Chapter Medicare become invaluable. They offer free, no-obligation reviews of your current Medicare coverage to help you find better options that could significantly reduce your monthly costs. I'm not talking about small savings here. We're talking about the potential to save hundreds of dollars per month by switching to a plan that better fits your specific needs. Let me share some real examples of the savings people have achieved. One retiree from Florida was paying over $400 per month for Medicare supplements and prescription coverage. After a free review, Chapter Medicare helped her find equivalent coverage for just $180 per month. That's a savings of $220 every month, or $2,640 per year. Another beneficiary in Texas was able to reduce his monthly Medicare costs from $320 to $95 while actually getting better prescription drug coverage. The process is straightforward and doesn't cost you anything. Chapter Medicare's licensed agents review your current coverage, analyze your specific healthcare needs, and compare all available options in your area. They look at factors like your prescription medications, preferred doctors, and typical healthcare usage to find plans that provide the coverage you need at the lowest possible cost. There's no pressure to switch, no hidden fees, and no obligation to purchase anything. What makes this service particularly valuable is that Medicare rules and options are incredibly complex. The average person would need to spend hours researching dozens of different plans, trying to understand coverage details, formularies, and cost structures. Chapter Medicare does all of that work for you, presenting you with clear comparisons and recommendations based on your individual situation. The testimonials speak for themselves. Sarah from Arizona said she saved over $150 per month after her review, money she now uses for groceries and medication copays. Robert from Ohio Discove aired he was eligible for a Medicare Advantage plan that actually pays him a monthly allowance while providing better coverage than his previous plan. These aren't isolated cases. Thousands of beneficiaries have found significant savings through proper Medicare plan optimization. The timing for this review couldn't be more critical. With Medicare premiums set to increase by 11.6%, every dollar you can save becomes even more important. If you can reduce your total Medicare costs by even $50 per month through better plan selection, you've not only offset a portion of the premium increase, but you've also improved your overall financial position. But beyond immediate savings, there's the long-term strategy of staying informed and proactive about Medicare changes. Set up alerts for Medicare policy updates, mark your calendar for annual enrollment periods, and make plan review a regular part of your financial routine. Medicare is not a set-it-and-forget-it program. It requires ongoing attention to ensure you're getting the best value. Consider building a buffer in your budget specifically for healthcare cost increases. If you can set aside even $25 per month in a separate account designated for Medicare premium increases, you'll have a financial cushion when these inevitable rises occur. It's not a complete solution, but it can help smooth out the impact on your monthly cash flow. For those who qualify, explore additional programs that might help offset Medicare costs. Some states offer Medicare savings programs that can help pay premiums and other costs for beneficiaries with limited income. There are also prescription assistance programs, utility assistance, and food programs specifically designed for seniors facing financial challenges. The bottom line is this: that 11.6% Medicare premium increase is coming whether we like it or not. It's going to hit 70 million beneficiaries and potentially wipe out most or all of their cost of living adjustments. But you don't have to be a passive victim of these changes. By taking action now to optimize your Medicare coverage, you can minimize the financial impact and potentially save hundreds of dollars every month. Don't wait until the premium increases take effect to start looking at your options. The sooner you review your coverage, the sooner you can start saving money. Contact Chapter Medicare for a free review of your plans. Explore all available options in your area and make sure you're not paying more than necessary for your healthcare coverage. If this video helped you understand how these Medicare premium increases will impact your Social Security benefits, please hit that like button and share this information with other seniors who need to know what's coming. Subscribe to Financial Area for more updates on policy changes that affect your wallet. And remember, staying informed is the first step in protecting your financial future. The Medicare premium increase is significant, but with the right strategy, you can minimize its impact on your retirement security.